once again. Today's topic is influenza infection. I'm going to explain how to avoid influenza infection and what to do when you are infected during your travel in Japan. You can see that? Okay. Influenza infection is very common in Japan in the winter time, in January, February, and March. The symptoms of the influenza infection are common cold symptoms like sneezing, coughing, or sore throat. And in addition to this common cold symptom, you are going to have relatively high fever, normally 38.5 degrees Celsius or 101 degree Fahrenheit or higher. And also, the typical symptom, the whole body symptom of influenza infection is severe headache and joint pain. So, this is how to prevent it. It is of very importance to have flu vaccination before you come to Japan in this season. Flu vaccination will ameliorate your symptom, even though it will not prevent that you are going to catch influenza infection, but with this vaccination, your symptom is much lighter, much easier, okay? And when you stay in Japan, try to avoid close contact with 6 people. In the winter time, those who are flu symptoms like sneezing, sore throat, and sore throat or coughing, it is highly plausible that they are infected with influenza virus. So you should avoid close contact with them. And if you are infected with influenza infection, in order to avoid contamination to other people, you should stay away from other people, maybe in an isolated hotel room for a while. It's very pity, however. And these are the other methods to prevent influenza infection. Wash your hands and at least 6 times daily using soap and running water. If it is possible, use the alcohol-based hand rub or gel like this one, okay? You should use this gel in this way. You can see that. And it is also very important avoid touching eye, nose, or mouth with your hand because germ spread in this way. So maybe it is useful to wear mask because it avoid touching nose and mouth. I know that the most American, European people do not like to wear masks, but it is very useful. And third thing is that the clean and disinfectant surface and object that may be contaminated with germs like the flu, for example, the sputum or coughing and such kind of thing. If you are sick with flu symptom in Japan, then you should be contagious for a while. Throughout the time when you have fever, and even after that, even your temperature, body temperature goes down, but you are still contagious another 24 to 48 hours, so you should stay away from other family member. And during that time, cover your nose and mouth when you're coughing with tissue paper, like this. And after using this one, throw it away in the trash box immediately. And in that case, face mask is probably also useful, okay? In most of the Japanese medical institutions, even in a small clinic, a flu lab test, a very simple one, is available using nasal or throat swab. So the diagnosis of influenza infection is available in Japanese healthcare institution. Would you please do not forget to take acetaminophen paracetamol with you, because this is the only rather safe medication for fever with influenza infection. Other medication like ibuprofen, I do not recommend it. It could be dangerous. And if you get flu, there is an antiviral drug, especially to design to kill the influenza virus. However, it is very important for many people in foreign countries. Antibiotics is not effective to influenza infection because influenza virus is virus, not the bacteria. Antibiotics is only useful for bacteria. Yeah. So I hope you are going to enjoy the travel in Japan, even in the winter time. There are so many beautiful places in Japan. Hot spring onsen is very, very enjoyable in this season. But do not forget to prevent and treat influenza infection when you travel in Japan in winter time. Thank you for your attention.